congratulate the Health Secretary, Dr. Radhakrishnan.
Our Honorable Minister of Health, Medical Education and Family Welfare of Tamil Nadu, Thiru Ma Subramaniam, who has accepted the invitation and to grace this occasion as a chief guest. I welcome you, sir. I welcome our District Principal Secretary, Dr. J. Radhakrishnan, Principal of Health and Family Welfare Department of Tamil Nadu, and Dr. Gohanandam for this event. I welcome our Dean, senior consultants, and all other doctors and all the other supporting faculties of our institution who have come for this Hello Doctor initiation of this inauguration program. I welcome press and media members who have come for this Hello Doctors inauguration, who will take this message to the public to fully make use of this healthcare service. This Hello Doctor program is our chairman, Mr. Ravi Pachamusu's dream project, which is getting in by our chief guest. Before I conclude, I would like to say health is wealth, healthy nation and healthy society is our aim. We all support the family, friends and public for their well-being through this Hello Doctor program for continuous monitoring. This is the best way to make the society well and take the nation as the best in the world. Thank you for welcoming back. My respects and regards to our Honorable respected Health Secretary and our Ma'am Chairman and Vice President Dr. Raju and our local dignitary MLA here, and also my colleagues from SIMS Hospital and also journalist friends who gathered here. We frequently meet them. I had the privilege to tell you all that we have got two unique personalities here. One is the Health Minister, the other is our Health Secretary. The Health Minister, I worked with him as a City Health Officer in Chennai when he was the very popular People's Mayor, Makkal Mayor in Visalapuduvar. We worked a lot, and he was unique in starting many de-addiction centers in Chennai City, which are very successful in raiding, recovering a lot of people. We have started shelters for the beggars. We gathered and collected more than about 5,000 beggars around the streets of Chennai, and he was instrumental in grooming them up. He himself cleaned them, he groomed them, and we started shelters for them. And also when I was a communicable disease hospital director, he really pioneered a lot for its development. And I don't know how many of you know, he made an Asian Book of Records in marathon, crossing more than 500 marathon races. Even the last week when myself and VP went to his house, he was preparing to go to Bihar. He ran his race of 21 kilometers. Simultaneously, his son in London ran, and his grandson also ran and got these great awards. Such a wonderful personality, and he was ranked to be the most fittest person in the country, among the smartest cities, about a month back. These are all his credentials. There are no roads or the lanes left in Chennai without witnessing his visits during his tenure as a mayor. Similarly, other unique personality is our Health Secretary. I worked with him, under him as the Director of Communicable Disease Hospital. Also, when I was in UNICEF, I was able to see and witness the greatest service he did during tsunami in Nagapattinam as a collector. He still has got lots of orphan children adopted by him, and recently he got them married also. Such a wonderful, great human beings we have on the stage. To put it in a brief, this particular program was conceived by our chairman, Mr. Ravi Pachamuthu. It is to reduce human sufferings from our people. மனித துயரங்களை குறைப்பதற்கு சிம்ஸ் மருத்துவமனை எடுத்திருக்கின்ற மிகப்பெரிய முயற்சி. We need not stick only to the ivory towers of the hospital. With SIMS hospital, we should also go to the field and work for the people. This Hello Doctor scheme is nothing but extended arms of the hospital to reach the people at home. So as a unique event, we started seeing the discharge patient from the hospital to their houses and groom them with follow-up. That is what we conceived, and we did a trial, and it is now being inaugurated with the big personalities here. So discharge patients are followed up till their suffering, and again we want to extend our services to the geriatric patients, elderly patients. Actually in India, the second state which has got more than 60 years people living is next to Kerala is Tamil Nadu, and Chennai it is highest. All the people above 60 years require home care. There are people who are not able to come to the hospital, they need care at home. So to extend our services to the doorsteps, we wanted to do for the geriatric care, and again palliative care, and people suffering from chronic ailments, people who are not able to come to the hospital. A lot of NRI sons and daughters, they call us and they ask us to take care of their parents at home. So this is the procedure that we would try to follow in Hello Doctor. Once the call comes to our hospital, 2001, our coordinator will really organize the team of doctors and the nurses to visit to the houses and take care of them, the chronic ailments. And in emergency cases, the patients are counseled through telemedicine. We have got a system of televideographing. Through that, we counsel them, pick them up early for immediate intervention. This Hello Doctor scheme has also got Wi-Fi connected ECG machines. We have got phlebotomy lab services at home, supply of drugs to the elderly at the doorsteps, and also physiotherapy, counseling, telemedicine counseling, and if possible, the senior doctors who are the world celebrities who are working in the hospital could also be talked through video conference. We got a SIMS app also. This hospital is the first of its kind to start a social medicine department among the corporate hospitals, which has got international travel clinic and vaccination center, which is affiliated to the International Society of Travel Medicine, which is an organization of WHO. We give certificates for the people going abroad, vaccinating them, advising them, and also who are coming down to India for visits. So I would like to request you all to really propagate this idea of Hello Doctor scheme, to reach out the people who are suffering at home, and we can extend this expertise to the doorsteps. And this is going to be a showcasing model for the entire country, and I wish this program will be a great success in alleviating human suffering with the support of all the media, the experts available here. Thank you very much for coming. Thank you so much.